They are very good couple, exchanging views with them. And whenever I go to Dr. Prema, when I have not gone to her individually for any work, when I go to their house, she will somehow try to come down and see me and talk to me. All immediately appreciating all that I did, this, that. So now I used to feel those days, I have come across not only a good doctor, an interestingly good person. I am very happy to get associated with them. And I remember that day, a very jovial thing. Last time I spoke to her was, I went there suddenly on an important work, unconnected to treatment. It is something connected with administration, which they have been referring to me. Doctor said, come, sit down. He will go, why, I don't know why he is going to a barber for hair cutting. She is her comment about Dr. CVK. He is not having hair like you, but I don't know why he is wasting the time with the barber. The type of jovial thing. That again is a characteristic of an individual. Many of you may not have come across these type of things. Suppose I am moving close with Mr. Parsardi, Mr. Chari. They want to make very personal discussions to make my relationship closer. That is psychology. This has happened. And as a doctor, I should say, remember that I sent to her one very, I cannot mention the name here, or young girl, not young girl, I can say 32 years old person. To her, she was suffering from a gynec problem for 7 years. 1 week treatment. This is the test of her efficiency in treatment. And today I learnt many things from what all you have spoken. And I am new to this type of meetings or other functions. We are not used to it, you may be. And I asked some person, is it funeral type of thing? We are from a village where death day, either internment or next to this, some Vishesham we call, that's all. But here so many, because the Brahmin community people, they do so many things. Today is a day when we must all forget, particularly the family and friends must forget the sorrow portion and become happily remembering her, appreciating her qualities, and matter does not stop there. All others, doctors and others, should learn from her behavior, affection and goodness. That way society improves by these type of people's way of life. I am very happy that I was given an opportunity to talk about her. Thank you.
Thank you, sir. Shri D. Parthasarathy, Chairman, Dollar Company.
My apologies because I've got 2 fractures in the same leg and difficult for me to climb without a hand rail. Let me go back to history about 45 years ago. My mother became a patient of Dr. CVK when he and Dr. Prema returned back to India. On the introduction of Dr. Sauri Srinivasan, there used to be a clinical laboratory opposite Shalamar College called Srinivasa Clinical Laboratory, which used to be Indian Express, and they shifted over opposite Stella Maris. He introduced Dr. CVK to my father, saying, my friend has come there for diabetes, you go there, because she was not happy with the then present day, the distance are too far. When my father heard that Palato, there were 2 doctors practicing, he was taken back because Subbarayar office was very friendly with him. Then Mr. Ramamani, Mr. Paddu, his son Venkatraman, etc. First thing he did was to go and investigate who in Palatop is a doctor. Because Palatop is full of lawyers only and not doctors. Then he came to know about Dr. CVK's father, and he was a counsel also for the income tax, and many of his other friends, like Rangachari, my mentor, he gave him briefing about him there. And so from 68, my mother became a patient there. I used to see Dr. CVK when I used to go to my factory in Thandarpet. He will go to Stanley Hospital. So at the Ibrahimji Sanitary, I used to overtake his car and go, and he did not complain to my father that I was overspeeding. That's another issue. Later, see, in about 78, 79, my mother used to get a lot of this metabolic hydrolysis problem and be admitted to Wellington Hospital at the Wellington. And as this always happens at the dead of night, being there at home, I had to take her up. And when they telephoned CVK, said CVK is not there. But then I used to find him at Wellington because he would be escorting Dr. Prema to the Wellington hospital. That's how it used to happen. I met him there. I said, sir, you வரேன்னு பார்த்தா எங்கள் அம்மா வந்துட்டா சார் ஜோக்கிங்காக சொன்னேன். அது முடிஞ்சு போச்சு. Then it came on there. After period 78, 79, and CVK said, Mami, நீங்கள் வராதீங்க, உன் ஆத்துலேயே உங்களை வந்து பார்க்குறேன். End of 79, I think so. One day he came, he was coming home from visiting VHS there. I was also at home because it's a holiday for me. It was then he said, I've started this juvenile diabetic thing for treating young children. The typical response of my mother, a Malapiran, was, 4 கைதைக்கார வயசான பெரியவாள சக்கரை சாப்பிட முடியல, சின்ன பசங்க எப்படா சாப்பிடாமல் இருப்பா, ஒன்னால் முடிஞ்சத்தை கொடு. That is all the commitment which he gave. So normally what I do is used to make the check there, give it to my father. My father will go home to Palatop, come and see them, chit chat. Dr. Prema was Annamittakai. She will not leave him go without feeding him. And that used to go on for, say, from 80 till about 2000 there. 10-15 years before he passed away. One day both Dr. Prema and Dr. CVK had come home. My father, has come on by himself, and a very difficult patient. Dr. CVK was treating him also. But one day he had made a trip to go to Madras to Delhi, Delhi to Jodhpur, Jodhpur to Jaipur, Jaipur, Jodhpur, back to Jodhpur and back to Bombay, Bombay to Madras, all alone. He had a friend, Mr. G.D. Naidu of Coimbatore. They had a travel agency. He had just called his son. Hey, Gopal, ticket he automatically gave the ticket and picked me off. We were trying to tell him, I'm very healthy. Dr. Prema and Dr. CVK came home. He said, no, Joshin Julirka, no, my Bhatta with Dr. Prema said, Amma, Joshin Julirka Sari, Nadamadi in Ripanan Chonera. Adhe Vartada, correcta. Adan chance Kadacha section 144 prototype. I said, I will not allow you to go, so you will have to stay at home, use my driver, everything. And she has done not only our family a great thing there, also Dr. CVK, because my father was a very tough patient. Ivaral mello mudiyadu, tuppo mudiyadu. அந்த மாதிரி சமாஜம். அதுக்கப்புறம் I was interacting with Dr. Prema in 2012, 12-13, because then I was finding it difficult to climb up the stairs to go to the first floor. Sir, lift போடுங்க, நீயே பேசிக்கோன்னு சொல்லிட்டார். நான் பணம் கொடுக்குறேன், நீயே போய் பேசிக்கோன்னு. So I had to go and argue with her, lift போட்டு போயிட்டு இடிச்சு கட்டுறதானா, மேடம் இடிச்சு கட்ட வேண்டாம், இப்போ இருக்கிற கான்செப்ட் எப்படின்னா இருக்கிற பில்டிங்லேயே லிஃப்ட் போட்டு கொடுக்குறான். ஸோ நீயே பார்த்துக்கோ அப்படின்னா, ஸோ இப்போ இன்வெஸ்டிகேட் பண்ணி எல்லாம் பண்ணி கடைசியில் 2014 லிஃப்ட் போட்டு கொடுத்துட்டோம். That was the last interaction. அதுக்கப்புறம் நான் interact பண்ணேன். But this is what my sisters were her patients. But my sex has not facilitated me to become her patient at all. So this is the interaction. And even in July, August, I interacted with her. They lifted it. So my respect for Prema is Annamittakai. He has helped a great thing for my father till he passed away in 2009 at 99 years old with no problem. So that is all that because நடமாடி இருப்பான்னு ஒரு வார்த்தை கேட்டால் பாருங்க, அதில் தான் எங்களுக்கு நடந்தது.
Thank you, sir. I invite Professor S. Suresh, Honorary Secretary, VHS.
Friends, today we have gathered here to celebrate a human being, a true human being who lived and continues to live in our hearts. I take you back to the year 1982 because my association with Dr. Prema is very different from the people who have spoken before me. In 1982, there was a young doctor who was searching for actually a career after finishing medicine, not knowing what to do, in search of an identity with ambitions of serving the society. At that time, and of course even now, I think if a person has to find a place and be successful in medical practice, he or she needs a mentor and the support of the medical fraternity, especially if the practice is going to be in a specialty that dependent on referrals. That young doctor was none other than myself, and the specialty was ultrasound, which at that time most people knew very little about. And I was actually entering an area which we were not sure whether it will be successful or no. So as I was searching about where to start my practice, I found out that there was one Dr. Prema, who was a popular gynecologist in Alvarpet. And since ultrasound was largely used in obstetrics and gynecology, I decided to set up a clinic very close to her clinic, thinking that because of proximity, I will be able to get referrals from her. This is the truth. And I had not known her at the time. And actually, I was too terrified to go and talk to her. But naturally, I had to go and invite her for the inaugural function. And I was pleasantly surprised that she spoke to me with so much of warmth and affection. And she was very happy that I was trained in ultrasound, because she said, actually, I was looking for somebody who will do ultrasound, because she had already known about it. That means she had kept pace with what's happening in the world at the time. Half my fears disappeared at the time. From the next day, sir. Sir.
The first ultrasound was done in Glasgow by Ian Donald.
Yes.
He was one of his.
Yes, sir. Yes, sir. From the next day, she started flooding me with her patients and actually demanded quality reports. Whenever I made a correct diagnosis, she called and said, Suresh, you are very good. And when I was wrong, she said, Koncham paathukopa. And continued to say that I was good in my work. So the fact is, I was never retributed or reprimanded for some mistakes which were done. Of course, as a young doctor with a new modality, so much of challenges. The amount of encouragement that came, I said, I know that it gave me a very important thought, that it made me realize that I had to live up to her expectations. Because this Konjam Pathukappa, I don't know how long it will lasted, but it lasted as long as we had the association. And the other aspect of her was her smile, which everybody has spoken about. I think nobody cannot speak about that, which was constant and always wanted to try and create an opportunity. I wanted to create an opportunity for myself to go and see her smile. Because if there was a patient, I wanted to go and personally see her and wanted to tell about the patient, so that I knew that I would get a smile at that time. Her affection and concern for her patient was unmatched. And that she had that innate capacity to remove the anxiety factor from patients. That is, today we see pregnancy has been made into an anxiety state. They have made it out to be a disease, unfortunately. Because pregnancy truly is a physiological state, and truly the reason why that has become is ultrasound itself, because people think you're going to say something wrong. She made the patient feel the true joy of going through a pregnancy, and this is truly a mark of a great human being and a compassionate doctor in the true sense of the word. There are many instances I can recall interacting with her, and every time the conversation ended with a good word, a word of praise, and most importantly asking about my family. How is my wife? How is my child? How are my parents? And when my mother passed away, she was there at my house. I mean, this is extraordinary, I should say. Anytime I invited her to any of our family functions, she was there, and she and sir will always be there. She showed that she cared. I indeed consider it as a blessing to have had the opportunity to have been nurtured by her generosity. Today, when I told my staff of 35 years at Mediscan that I am attending this function, immediately they summed it up all in one sentence, which actually tells all. They said, Dr. Suresh and Indrani sowed the seeds of Mediscan. It was Dr. Prema who watered it every day and saw the growth of a plant and then onto a tree as it stands today. Of course, her, and this happened through her good words and generosity. They wanted me to specifically convey this, and I truly echo their sentiments. Lastly, she continues to live in our hearts, and I don't know when the world will see such a true human being again. She lived true to the Hippocratic oath. The song which was rendered today is a fitting tribute to her. I thank Mr. Artichari for arranging this lovely function, and I thank the family to have asked me to share a few thoughts. Thank you very much.
Thank you, sir. Dr. Lakshmi Vijay Kumar.
I think Am I the last, Lalita?
We have a few more people who want
Okay.
to share their thoughts.
Okay. When Dr. Prema enters a patient room, draped in one of her glorious saris, with her handbag tucked under her arm, with a wide, warm smile, as Dr. Suresh said, the anxieties of all the patients completely melt. I have experienced it because she delivered my daughter. She was wildly popular and hugely respected, and at any given point of time, she would see at least 100 patients a day. And she would probably have 2 or 3 minutes. As a psychiatrist, I used to be envious of the fact that in those 2-3 minutes, spontaneously, intuitively, she will connect with the patient so well that the patient will feel enveloped in her warmth. And that was truly an amazing skill which she had. The other thing is, even though she would have been tired and had seen so many patients, her smile never wavered, and her concern and compassion and the conviction with which she did the work was the same whether it was a princess or an Ayama. Probably the Ayama would benefit more because she would give her financial help also. She was that kind of a person. But however busy she was, she gave utmost priority to her family. Not only her immediate family, but her huge extended family of both Dr. CVK and her own sisters, a huge family. Anytime you go to their house, there will always be people around, you will always be fed. And in fact, I used to enjoy some of the snacks which they provide, so I'll time my visit there in that way. Everybody talked about the couple. I'm a bit skeptic of this made for each other phrase, but they really complemented each other. I just want to share one incident. Once in the middle of the night, even as psychiatrists, we do have some emergencies when there are some violent patients. We went to Isabel Hospital, and it was the middle of the night. And then I heard, Lakshmi, Lakshmi, and I turned and Dr. CVK was there. Come, come. Prema has come for an emergency. Look at my new Contessa Classic. Isn't it like a boat? And I looked around and then I said, sir, what is this knob outside? He said, Lakshmi, I'm in a lungi. I cannot get out. They will think I'm a driver. So he will, when Prema had an emergency, it doesn't matter. Dr. CVK would be there at any time of the night or day to be with her. That was, they were perfect for each other. They were really perfect for each other. Lalita tells me there are a few more people. All I can say is that maybe the song has ended, but the melody will remain forever in many thousands of grateful hearts. Thank you.
Thank you, Doctor. Dr. Geeta Haripriya.
Good evening, everybody. I feel very, very sorry that Dr. Prema has left all of us today, but she will always be remembered by all of us and her patients. My association with Madam was about 10 years ago when I approached her after coming back from the United Kingdom. Like Dr. Suresh, I went to her, I presented my work and asked her if any of her patients required help to have their babies, then I was there. Within 20 days, she just called me. I was really taken aback, surprised, and but I felt very honored that she recognized what I had presented to her, and she said, I think I have a patient